Hi everyone, my name is Denise. I'm a student physical therapist. This is my sister Paulina. She will be acting as a patient today. I will be demonstrating how to perform the Glasgow Coma scale or GCS, which measures a person's level of consciousness after a brain injury. The GCS is based on three elements, which are the eyes, or the patient's ability to move their eyes, to speak, and to move their body. And each response has a score. At the end of the test, we add up all the scores and come up with a number, and that will indicate that person's level of consciousness. The minimum score is a 3, and that means that the patient's either brain dead or in a deep coma state. And the maximum score is 15, which indicates a fully awake patient. The first thing we do before we start this scale is to check the patient's chart to see if there are any factors that will interfere with the assessment, such as eye swelling, any eye injury that will prevent the patient from opening their eyes, if the patient is nonverbal for any reason, if the patient has any hearing impairment, or if the patient's paralyzed. Then we observe if there's any spontaneous behavior without applying any stimuli. And then we rate the response according to the GCS. First, we're going to assess her eye movement. I check first if she has any spontaneous eye opening, which she doesn't. The next thing I'll do is apply a verbal stimuli by introducing myself and asking the patient to open her eyes. First at a normal volume, and then I'll shout if I need to. So, hi, my name is Denise. Can you please open your eyes for me? And the patient opened her eyes, so I would document that as to sound on the Glasgow Coma scale. If she didn't do that, then I would apply a pressure to her fingernail for at least 10 seconds with increased intensity. So I have a pen here, and it would look like this. And I would apply the stimuli there for at least 10 seconds with increased intensity, and I would check for her eyes to open. If she didn't open her eyes, then I would, well, if she opened her eyes to the pressure, I would document as to pressure. If she didn't, I would document as no response or NT, which means not testable. Next part is assessing the patient's verbal response. So the first thing I'll do now that she has her eyes open, I'm going to ask her her name, if she knows where she's at, and what month it is. Okay, so can you tell me your name?
Paulina.
Great. And do you know where you're at?
Your room.
Right. And can you tell me what month it is?
April.
Great. So she was able to answer all 3 questions correctly, so I would document as oriented. If she was able to speak in full sentences or phrases, but she did not know the answer to the questions, I would document as confused. If she was able to produce words, but the words didn't make any sense, I would document as words. If she didn't make any words, but she makes some sounds such as moaning or groaning, go ahead and moan and groan, like that, then I would document as sounds. If she had no verbal response at all, I would document as none or NT if she was nonverbal. The next part is to assess the patient's motor response. So the first thing I would do is ask the patient to perform a 2-step action. It can be either grab my hand and squeeze it, or open your mouth and stick your tongue out. So I'm going to ask her to do that right now. Paulina, can you grab my hand and squeeze it? Great. So she was able to do that. I would document patient able to obey command on the scale. It's a check mark actually, not like the whole thing. You just check mark obey command. If the patient's not able to obey commands, then I would have to apply a central stimuli. The central stimuli is actually if she wasn't able to respond to the peripheral stimuli or obey verbal command. So I would apply the central stimuli either to a trapezius pinch, which is superior to the clavicle and just right above the spine of the scapula. I would apply pressure for 10 seconds with increased intensity. If the patient didn't respond to that, then I would move to the supraorbital margin, and I would do the same thing, apply pressure for 10 seconds with increased intensity. So it would look like this. I would grab her scapula and squeeze for 10 seconds and see her response. If there was none, then I would move to the supraorbital margin, apply the pressure there. So I wouldn't use that stimuli if the patient had injury to the area. But if the patient responded by moving her hand to the area that I'm applying the pressure, I would document as localizing on the scale. If she didn't have any response, I would document depending on her response. So it can be either normal flexion, abnormal flexion, or extension. So normal flexion would be if she rapidly bends her elbow and moves her hand away from her body. Abnormal flexion would be if she bends the elbow slightly and across from her body. And extension would be if she extends her arm instead of bending it. And if the patient did not have any response with any of my stimuli, then I would document as either no response or NT if the patient was paralyzed. So in this case, our patient was able to open her eyes to sound, and she was able to tell us her name, where she's at, and the month correctly. And she was also able to squeeze my hand. So her total score would be 14.